Hello, and welcome to the American Massage and Chiropractic Conference pre-conference broadcast series on One Concept Radio. I'm Felicia Brown, and I'll be your host for this interview and series. This is one of several broadcasts with the presenters and experts who are appearing in Atlanta, Georgia, May 17th through 19th, 2013, and who are brought to you by One Concept. I'd like to take this opportunity to thank the 2013 American Massage and Chiropractic Conference sponsors, Massage Warehouse Script, MPA Media, ABMP, BioFreeze, and Massage Envy Careers for making this year's event possible. Our special guest today is James Waslaski. James and I will be talking about his 4 classes on orthopedic massage. But first, let me tell you a little about James. James Waslaski is an author and international lecturer who teaches approximately 40 seminars per year around the globe. He's served as AMTA Sports Massage Chair and FSMTA Professional Relations Chair. He's developed 7 orthopedic massage and sports injury DVDs and authored manuals on advanced orthopedic massage and client self-care. James is also a certified personal trainer with the National Academy of Sports Medicine. James presents at state, national, and international massage, chiropractic, and osteopathic conventions, including keynote addresses at the FSMTA, World of Wellness, New England Regional Conference, the World Massage Festival, and Australian National Massage Conventions. His audience includes massage and physical therapists, as well as athletic trainers, chiropractors, osteopaths, nurses, and physicians. James received the 1999 FSMTA International Achievement Award and was inducted into the 2008 Massage Therapy Hall of Fame. James, welcome to the American Massage and Chiropractic Conference pre-conference broadcast series on One Concept Radio. Thanks, as always, for making time to talk with me about the event and your classes on orthopedic massage.
Thanks, Felicia. It's really an honor and a privilege to be part of this amazing group that comes together twice a year for the American Massage Conference. I'm always intrigued at the people that show up and the friendliness and the family type of environment that we have with these people. So it's certainly an honor and a privilege to be coming back to the American Massage Conference.
Well, as always, we're excited to hear more about what you're going to be sharing at the conference. And, you know, I love just getting a chance to see you at the conferences and hang out a little bit.
Well, thanks. It's mutual. It's been fun.
Now, part of this year's focus is a little bit different, and we're really focusing on the idea of creating community by adding a community room where attendees at the conference can visit with speakers more personally and learn just how they can make a real difference at home and in our profession. So I'm curious, why do you think it's important to create community in the massage or healing arts world, in our practices and businesses, and at the conference?
Felicia, I think this is the critical part of what got me where I'm at today. You know, early on, I would find people like Aaron Mattis and Benny Vaughn and Mike McGillicuddy, and they actually took me under their wing. I didn't meet them in a classroom environment because they're on that stage, they're in the limelight, they're doing their thing, and they're very focused. But outside of the classroom, I think it's awesome because these people share lifetime friendships with me now. These people motivate you. They tell you what works, what doesn't work in the industry. Really, it's an honor and a privilege as a teacher to mentor students and say, if you want to achieve these goals, this is how you get there. And most of the people in this amazing healing industry are humble enough to say, you know what, let me take that person under my wing, let me give them some ideas, let me inspire them, and let me make them all they can be in this industry. So that's my favorite part of the whole conference is the opportunity to mentor and to hang out with my mentors at the same time in that environment.
No doubt. And I think one thing that I see with this community room, and you talk about the idea of mentoring, is really for those of us that are the quote-unquote experts, and the mentors, the gurus as yourself, that we pass on the legacy of what it means to be a mentor to the people that are at the conference, and that they too have that opportunity to take someone under their wing, to mentor someone, whether it's a student or maybe even a client that is hungry for information and wants to do something in this field.
And I think that's critical, Felicia. I think they see the human side of us, the person that's not on that stage, very focused, trying to inspire and motivate, but they see the person that has a family, the person that talks about their pets, their animals, the person that says, life is in a journey and we should enjoy the journey. So, like I said, I think it's going to be awesome for the new therapists. It's going to be fantastic for the veterans of the industry. Just last time I met people like Judith Aston and Mark Land and Eric Dalton, and they always still inspire me to step it up and to do something different with what I teach. So I'm looking forward to myself to hanging out with both the students and mentors.
Likewise. Now, James, we really want to talk about your class, and I know you being the busy man you are, we have to jump right in on this. So let's just get started by, if you could share with the people listening what orthopedic massage is and how it compares to modalities such as medical massage, clinical massage, or sports massage.
Felicia, when I got started in massage 20-some years ago, you would specialize in one modality, say myofascial, neuromuscular, craniosacral, visceral. Orthopedic massage is really developed out of multiple specializations. It's a total system. It's a package of assessment and clinical reasoning where we gather critical information as to what their goal is, their injury, how to evaluate. It actually blends modalities. So we teach you specifically when do you do myofascial, when do you do trigger point work, when and how do you know to do scar tissue mobilization. Our specialization is joint capsule work. And now we're even branching in, whether you call what I do medical massage, clinical sports massage, it's really kind of a change on what I call buzzwords. It's a change on techniques. So whether you're a medical massage student, orthopedic is going to fit perfectly into your system. If you work with athletes, I spent 20 years in the field of clinical sports massage. So whether that client is an athlete or the lay person, whether they're in a spa or a healthcare center, what it does is it gives you a system to evaluate, look at joint interplay, look at the whole body relationship of pain, and most importantly, it gives all manual therapists the ability to design a corrective stretch and exercise program to maintain the outcomes of massage therapy.
Now, you mentioned massage therapists in particular. Are there other types of manual therapists that would benefit from this work?
Well, here's my whole system of education is changing now. I'm integrating into, I'm doing the osteopathic convention in Ireland this year. I've been teaching at the chiropractic conventions, and what we're doing now is through this system of evaluation, blending of disciplines, and then corrective exercises where we stretch tight, facilitated, and strengthen weak inhibited muscles. I'm finding that the chiropractor, the osteopath, the physical therapist, the athletic trainer, we're finding that some, like in Seattle, the Sounders interviewed a number of athletic trainers. The one that got the job was because he was an athletic trainer who was also certified in orthopedic massage. Right. So they knew he had more soft tissue balancing skills. They knew that he could do movement analysis and analyze overactive and underactive muscles. And in the osteopathic world, I know that the reason they're bringing me to Ireland to teach their convention is they go, we need more soft tissue rebalancing. We need to address the source of why those muscles are going out of alignment and not staying in alignment. And we need the opportunity to teach the client corrective exercises where they stretch around every joint in the body, those tight facilitated muscles and those weak inhibited muscles. So I'm finding that as I grow in the industry and combine more posturology and myoskeletal alignment and musculoskeletal and structural body work, that all manual therapists, everybody in the industry that deals with a patient in pain can certainly and drastically benefit by this work.
Fantastic. Now, it sounds like from what you're saying that really anybody can do it, but is orthopedic massage really that easily implemented into a spa treatment or a chiropractic session?
The beauty of that is when we wrote our clinical massage book with Pearson Education, they asked us specifically to show a chapter on draping. I work more like a physical therapist where you wear shorts and a sports bra, but because we want to implement it, number one, it's pain-free, Felicia, and that's something that I take a lot of honor in saying that I'm not, the code of ethics said do no harm. When you cause pain, you actually induce a protective cycle in the body. So in the spa environment, what we're teaching you to do is say it's an extremity injury. You can drape, you can evaluate, you can do a systematic approach before before or while they're on the table. You can gently, a lot of the people that work in spas, places like Massage Envy, they'll say to me, you know what, Jim, what I do is I sneak in orthopedic massage. It's so gentle, so powerful, and so effective that sometimes the client isn't even aware that I'm treating that knee pain, that back pain, that shoulder pain, but I'm still working tight muscles first, relaxing weak muscles, working on that scar tissue, doing the capsular work to the hips and shoulders, and it's so pain-free that the client is almost unaware that it's being applied. So certainly it would be a transition for the spa therapist who wants to do both relaxation and get people out of pain.
Excellent. Well, that makes perfect sense to me. And I guess that kind of follows into the concept of what you talk about in terms of recession-proofing someone's practice with this training. Can you elaborate on that a little?
I think the key is when our economy gets tough, people, the luxury of a relaxation massage becomes something that we can put on the side. But I think when we're in pain, when I'm in pain, I can't function right. I can't help other people. So when I'm in pain, I'm going to go to a manual therapist who has assessment and skills and clinical reasoning skills, who can evaluate me, who can say, hey, if we lengthen those short muscles, relax those weak muscles. As far as recession-proof, I find, I teach at spas like I teach the Four Seasons in Maui, and I teach the Fairmont Kealani, and I teach at Canyon Ranch. And what we're finding is that if you can do clinical skills, especially the male therapist in the spa environment, if you can get somebody out of pain, you're going to have a much, much higher request for therapies, and your name's going to spread really fast. Hey, I want so-and-so at the Four Seasons because last time I came here, my back or shoulder or neck was hurting, and I left there pain-free. They gave me some exercises. I think that makes you stand out. I'm giving you, as a certified personal trainer, I can prescribe in stretches for tight muscles, strengthening for weak muscles, and look at, through your movement analysis, over and underactive muscles, and that can be easily done in the spa to recession-proof your practice.
Fantastic. Now, people are probably getting intrigued about what they are going to learn from you at the American Massage Conference. So let's talk about the 4 different classes you have. Let's start with Introduction to Orthopedic Massage.
Introduction to Orthopedic Massage is, as you mentioned in the opening, what is orthopedic massage? So what we do is we lay out a 12-step system where we say, okay, there's client history, then there's assessment of active, passive, resisted range of motion. We go into things like what modalities do we blend, how do we know when to do different modalities, and how to teach the client to get actively involved in their stretches and exercises to keep their body in balance for pain-free living and optimum athletic performance. So what we do in the intro of orthopedic massage is we say, this is what it is. Now let's pull some people up here that have had back pain for 10, 15, 20 years. Let's pull somebody up here that has a frozen shoulder, because that's my trademark, is releasing encapsulations of shoulders and hips. And so in the introduction, not only do they see, and the great thing about the way I teach, Felicia, is that when we wrote the book over 6 years with Pearson Education, we actually put dissections in the human body through everything. So when I'm teaching, they're seeing 2 screens. They're seeing inside of the human body with my hand on your psoas or on the scar tissue or on the C1, C2 mobilization. So we're making it cater to the kinesthetic, audio, visual learning styles of everybody. And in that introduction, they're going to be enticed to see, hey, not only is this the system, but let's bring some patients up here and show you that it works.
Fantastic. And then how is the class Orthopedic Massage for Complicated Forearm, Wrist, and Hand Conditions set up?
The great thing about this course, Felicia, is we've just shot 5 new DVDs. And what we did with one of them is, in the forearm, wrist, and hand course, one of the things obviously we talk about is, what portion of carpal tunnel comes from your wrist, what portion comes from your elbow. But what we also add to this course, which is amazing, is nerve compression tests, because when you have things like carpal tunnel, first the nerves get compressed as they come out of the spinal cord and the cervical nerve roots, then they get compressed in your scalenes, and then they get compressed under your pec minor, and then they follow through into the arm, into the bicipital aponeurosis and the pronator teres. So they'll come expecting us to say, you can treat carpal tunnel by working the forearm, hand, and wrist, and they'll realize that there's multiple crush phenomena relating to neck, shoulder, arm, wrist, and hand. So we'll visit the whole circuit. We'll also talk about the difference between tendinosis and tendinitis, because that still hasn't been changed in medical textbooks around the world. So who'll be really enlightened on our universal way of treating tendon pain without creating additional inflammation will be the other manual therapists, the chiropractors and so on. But I think in the forearm and hand we get into everything from Decroven's tenosynovitis to Dupuytren's syndrome to carpal tunnel to tendinosis of the elbow, tennis elbow, golfer's elbow. We break it down to what it is, which muscles are tight, which muscles are weak. But the beauty of the forearm and hand seminar is that they will also take a look at the circuit between the brain, through the neck, into the shoulder, elbow, and then into the forearm and hand for nerve pain.
You're going to cover a lot of stuff. I know people are going to get a tremendous amount of information.
And the beauty of it is, Felicia, it's always 60% hands-on. As kinesthetic learners, we need to experience the work, feel it, and apply it to our partners to learn to really comprehend the work. So I'm always making sure that every course, whether it's 3 hours, 4 hours, 8 hours, 20 hours, 40 hours, they're going to get hands-on training.
Fantastic. And then you mentioned your specialty with the shoulder. So the next class is orthopedic massage for complicated shoulder conditions and double crush phenomenon, as well as pelvic stabilization, the key to structural integration.
Felicia, I'm more than passionate about the new aspect of this that I'll be bringing to the table. We have, through peer review is when people like Ruth Werner, question what's really happening with the frozen shoulder, or Dr. Eric Dalton shares new research and clinical studies. Through peer review, I have drastically changed in fact, I've changed the frozen shoulder protocol so much over the last year since the last conference that we reshot the video last week, and we're just in the final stage of editing this week. And what we're doing, Felicia, is we're actually looking inside of the human body in this class. We're going to show the difference of interfascial adhesions, which doesn't even exist in medical textbooks. We had to bring that out from real dissections. We're going to show you strain, counter-strain, and positional release that allows the scar tissue of the capsule to release. We're going to show you how to look at thoracic outlet, shoulder impingement. I'm going to share a case study of my own where I had 2/3 of my posterior rotator cuff removed from Mohs microscopic surgery for cancer, and I've regrown the whole muscle through the therapies that I'll be showing them. So the shoulder is 100% functional with 2/3 of that muscle surgically removed. Without surgery, we're going to show them how to treat rotator cuff injuries, and that the majority of these conditions, me, Felicia, I'm always pushing that envelope of scientific medicine. But when peer review comes out and research comes out and something new happens, not only do I have to change the videos and update the manuals and so on, but I have to I'm going to bring somebody from the audience that's got a long-term frozen shoulder with numbness, tingling, paresthesia into the arm. And I really hope a lot of chiropractors show up for this class, because we're going to show you some myoskeletal alignment techniques of Dr. Eric Dalton's for shoulder capsular work. We're going to show you some mobilization of C1, C2 coming into the nerves of the shoulder from Paul St. John's posturology work. So because of all the new information, even since the last time I was at the American Massage Conferences, I'm so passionate and so excited about this particular course.
Well, it sounds fascinating, and I hope I get to at least peek my head in the door for a little bit of that, because, wow, it's so amazing to hear about the shoulder recovery without all of the muscle being there.
And just one last thing on that. We're doing a thing at Northwestern University in Minneapolis, and I'm working with a pathologist. So what we're doing is going into the dissection lab. We're dissecting a frozen shoulder. We're dissecting the nerve area of the neck and shoulder, and that will be before this conference. So we're filming all of this. So as I work with the neurologist and the pathologist and the doctors of chiropractic in the dissection lab in this symposium and bring in a real frozen shoulder, this will all be recorded. So they'll get to see me working with neurologist, pathologist, doctor of chiropractic, and the dissection lab of a person where we're looking at the capsule in the true lab setting.
That's going to be awesome.
Yeah.
And then the last class you're teaching at this year's conference is orthopedic massage for complicated cervical conditions, which is all new, and some elite sports therapy.
The orthopedic for cervical conditions, again, has evolved tremendously thanks to my colleagues, Dr. Eric Dalton and Paul St. John. We are going to show the chiropractors and the manipulative therapists a gentler way to mobilize the spinal axial joint, to get rid of shearing forces at C1, C2, how to gently open and close facet joints without any forms of high-velocity thrusting. And I have chiropractors around the world that are my teaching assistants now, and they said, you know what, I wish I had known this out of chiropractic school. This is cutting edge. This is the most dynamic work. It's gentle. You know, if they've got a cervical sprain and strain, we don't have to stir up the tearing of the muscles and ligaments through high-velocity work anymore. I believe that the chiropractors will be intrigued by this work, but I believe that the manual therapists who are primarily focusing on muscle groups, tight facilitated, will take their cervical work to a whole nother level, and obviously will tie in the nerve pathologies, nerve compression sections of the cervical work into what they would have learned in the shoulder work. And then the elite sports therapy, you know, I was trained by leaders like Benny Vaughn, who I believe is one of the greatest sports massage therapists on the planet. And over the years, there's been a lot of evolution of sports massage, but what I'm bringing back as a certified personal trainer with the National Academy of Sports Medicine is I'm going to look at movement analysis over and underactive muscle relationships, because the beauty of looking at someone do a squat or push or pull exercise, the beauty of this in elite sports therapy is that we can look at things like joint interplay. You know, I'm going to show them how if the foot's hyperpronating, how the tibia internally rotates, and how the knee pain is actually coming from the foot strike, and how the knee pain is oftentimes coming from the imbalance of the hip to rotate properly. I'm going to show them preventative medicine things. You know, sports massage is generally known as, let's show you a 10-minute pre-event routine, let's show you a 10-minute post-event routine, let's work a 5K event. But the elite and Olympic and professional athletes, they need something far beyond pre- and post-event. So what we're bringing to the plate as a certified personal trainer is to do movement analysis and then have them stretch or us physically lengthen overactive muscles, show them how to tonify, turn on, and strengthen weak muscles. And one example I'll use that'll be in this workshop, if someone's tight, hip flexors are tight, the iliopsoas and quads, which are common in athletes, the brain tells the glutes to turn off. So now we get a synergistic dominance where the hamstrings and the rectus spinae are firing without the glutes firing. Their back hurts. Their performance is diminished. And we'll show them how to lengthen the tight facilitated muscles along with capsular work review. And we'll show them how to use dynamic gamma motor neuron techniques to turn the glutes on so that they fire, increasing performance potential and eliminating the potential for injuries in both the layperson and the athlete. So I think it's going to be the next level of sports massage. I call it elite level sports massage because we're looking at the whole body relationship of movement analysis, biomechanics. It's going to be quite an intriguing course.
Most definitely. Well, everything you teach is intriguing. So now, James, you've been talking a little bit today about your new DVDs. I believe 5 new DVDs with the title Integrated Manual Therapy. You've been doing this because you're rapidly growing this work into the market for chiropractors, physical therapists, osteopaths, acupuncturists, athletic trainers, and other leading pain management practitioners. Can you talk about a little bit more about that huge transition with your seminars?
Felicia, over the years, especially when I go to Australia or when I go to Ireland or Scotland, the majority of my practitioners are physios, they're osteopaths, they're people that have fantastic skeletal mobilization techniques, but they are the first ones to admit that they don't have enough soft tissue rebalancing techniques. So my classes are becoming much more accommodating to the athletic trainer, the osteopath, the chiropractor, the physical therapist. The reason we're calling our new DVDs Integrated Manual Therapy is, honestly, I'm going to say, Felicia, it's more than just massage therapy. We're doing assessment, clinical reasoning. We're looking at joint interplay. We're differentiating when there's a bone fixation versus a muscle tension problem. We're showing you specific skills to analyze over and underactive muscles. And because I'm a personal trainer, I'm going to give you some amazing techniques to teach clients throughout the entire body how to stretch tight facilitated muscles and strengthen weak and inhibited muscles. So I'm going to combine, say, the work of Aaron Mattis for the stretching, but I'm not going to stretch weak muscles. I'm going to turn them on neurologically, show you how to give them specific TheraBand exercises to strengthen those muscles. And I think the beauty of this is that next year alone, I'm going to be teaching probably in 10 countries, and most of my audience when I go out of the United States are osteopaths, physios. We get a lot of athletic trainers, a lot of PTs, and a lot of chiropractors. So I'm really excited about bridging the gap. This has been my passion, as you know, for 10 or 15 years, is to integrated manual therapy. Has said, how do I integrate multiple modalities of massage therapy into the hands of the practitioner who has, in my opinion, or not my opinion, but feedback from the PTs, feedback from the chiropractors, they said, we wish we had gotten more soft tissue rebalancing. We wish we had gotten more assessments, skills for sprains and strains. And the one trademark of mine that has gotten me throughout the world into the other markets is the ability to do the dance between releasing frozen hips and frozen shoulders while balancing out muscles, treating sprains and strains painlessly and looking at the patient as a whole patient. That spiritual, emotional, physical, energetic human being that we can tap into all those aspects of their healing.
Well, I know that you've really been doing more of that with the mind, body, physical, mental, spiritual, and I think that's exciting that you're integrating that more openly into your presentations now. But talking about the DVDs and this work with these other types of manual therapists, I'm curious, is that going to drastically change the presentations that you're doing this year compared to the ones you've done at the American Massage Conference in the past?
I have to say, Felicia, there's going to be a 50% shift. And so, we did a video on the brand new one on frozen shoulder, and what I taught them last year, there's a whole new pattern of it. We're going into strain, counter strain first. We're letting the body relax. We're showing distraction techniques. It's so drastically different that we reshot the frozen shoulder video for complicated shoulder conditions. We redid the pelvic stabilization because I'm going to show how to level off the sacral base, get rid of sacral torsions. None of that was taught at previous American Massage Conferences. We're getting into corrective exercises for over and underactive muscles for the upper and lower body, and this is going to be critical for all of the manual therapists, and I really want to pull the chiropractors in here too, because if we manipulate the skeletal system and the person goes back to repetitive motions, poor ergonomics, and poor postures, and they don't stretch the tight facilitated muscles and strengthen weak inhibited muscles. So we did shoulder over, we did all the pelvic stave over to bring in skeletal alignment techniques, leveling off the cranial base, getting rid of sacral torsions, all of those types of techniques, looking at how the lumbar spine has to sit on a level sacral base, and if it's not, then we're going to have disc degeneration. So I'm not doing high velocity, but I am certainly going to be teaching pre and post chiropractic adjustment techniques that either the chiropractor or the manual therapist can do in their office. I'm going to be teaching all manual therapists to empower the patient to take responsibility of keeping their muscle groups and their joints in balance. And I think it's going to be at least a 50% transition. So if you've attended the American Massage Conference and taken my classes before, don't think that this is going to be the same old stuff, because it's a 50% improvement on what you learned last time.
Now, let's talk about your teaching just for a minute. You are going to be teaching next year in a number of other countries, including Canada, Ireland, Scotland, Australia, New Zealand, even Bali. Why this huge transition into other countries? And for those people that want to be in your classes, I'm sure they're curious, how is this going to affect your availability to teach major seminars in the U.S.?
Well, Felicia, I think that my passion is now to start training the people who have been under my wing for 10 or 15 years, to start teaching my weekend courses. So my goal in the next year or two is to be doing most of my seminars internationally. So I will be not on the road 40-some weekends a year in the United States any longer. My goal is to open a clinic where we can work with the wounded warriors, where people can come in and do internships so we can treat these soldiers for free. My goal is to really, really bring this to the manual therapy world outside of massage therapy, to hit more athletic trainers, more chiropractors, more osteopaths. I have the knowledge and the expertise to bring their work to another level, not to supplace what they do, not to challenge what they do, but to complement the great work that the chiropractors and physical therapists do. So as I grow into the chiropractic, physical therapy, osteopathic, athletic training, personal training markets over the next year or two, I also want to do internships where they all come back. In fact, we're going to do a cruise in January where we're perhaps going to bring in a chiropractor and a PT and myself to integrate and show you how, when we all work together as a team, we can change the world one body at a time. And I'm excited. So I'm going to say I'm not retiring in the United States, but certainly my availability to teach conferences and individual workshops will be cut probably in half as I branch more internationally.
Well, some very lofty and exciting goals, and I know that people are going to want to take your classes while they're available in the U.S., or maybe they just want to come to Bali and take a class.
Yeah, that would be a wonderful experience, I guarantee it.
I know. Well, James, tell us how people can get in touch with you and find out more information about what you do, what classes you're offering, et cetera.
I'm excited. Our new website is coming up this week, and if they go to orthomassage.net, that's O-R-T-H-O massage.net, N-E-T, not .com, orthomassage.net, or they call 1-800-643-5543. What we're going to have on our new website, by the way, is we're going to have live testimonials from chiropractors, doctors, physical therapists, how this has changed their career and changed the way they treat patients. We're going to have live footage of releasing frozen shoulders because that seems some of the industry practitioners seem skeptical about that. So we're going to have live interviews of real patients getting real results with this work. It's going to be huge. So again, to reach me, www.orthomassage, O-R-T-H-O-massage.net, and 1-800-643-5543, and our 5 new DVDs will be available in 2 to 3 weeks. I guarantee it'll change the way you treat people in pain.
No doubt. Well, James, thank you so much for sharing all this great information and for choosing to be a part of the 2013 American Massage and Chiropractic Conference. We are extremely honored to have you at this year's event.
Felicia, this is, on a personal level, the people at this conference are like my family, the hosts, the guests, the people, the sponsors. So I wanted to say that this is one of my favorite conferences in the world, certainly cutting edge as far as bringing other manual therapists together. And I certainly think that practitioners of all nature in the field of manual therapy should attend, and I guarantee you they will be enlightened and empowered to change the lives of their patients. So thanks. It's an honor and a privilege to work with you guys.
Likewise, James. And now I want to just switch gears and make sure everyone knows how to register for the conference. The American Massage Conference is one of the largest exhibitions of massage and chiropractic products, continuing education, and business opportunities for practitioners of both disciplines. This year's Massage and Chiropractic Conference will feature over 100 exhibitors, continuing education classes of 1 hour, 3 hour, and 1 day workshops, including James's. Other events during the weekend include Friday night's famous Facebook meet and greet, where our theme is disco, and the One Concept Gala on Saturday night. For students, the conference offers a free student day and Smart from the Start program on Friday, May 17th, which is sponsored by Massage Envy, Massage Warehouse Script, and BioFreeze, as well as Bon Vital. This day is dedicated to massage and chiropractic students who are currently enrolled in school or who will graduate in 2013, and includes access to our opening session and trade show on Friday. This year, we have a new conference value pass, which is just $87, and that includes access to all 1 hour CE presentations, the trade show, contests, events, community room, and more. But we are also introducing the One Concept Pass, your ticket to full conference access. The One Concept Pass is just $349, or if you purchase early, $299. It includes full days with James Waslaski and Eric Brown, all 3 hour classes, and other 1 hour presentations. CEs are included for chiropractors, and all education is improved by NCB TMB and Florida CE Broker. It also includes lunch each day, as well as access to the trade show, the chance to participate in contests and raffles, and be a part of special events, the community area, and more. So reserve your place now with the full conference pass, the One Concept Pass that is, and save hundreds of dollars.